There you go. Okay. If somebody cannot hear me, please let us know in the chat box. But I believe we should be it should be working now. Okay. Good morning, everybody. I hope you guys had enough coffee already. I'm already in my second cup. It's a bit early, sort of, but it's never too early to start this dance, the data standards dance, that is. I'm Jesus. I hold the honor of being the HMIS program manager for the balance of state. Huge effort, if you ask me. Wouldn't be able to do it without the help of the THN HMIS data team, to be honest. Victoria Lopez and Benjamin Mahoney, they make everything go around. Victoria's here, and Ben is somewhere else right now.
I think he needs to know.
Okay. All right, so I'm sure that you guys are ready for this. This is the agenda. It's pretty simple and straightforward. We're gonna have a mini review, so I can show you in some slides what changed, what is gonna look different. I just wanna make sure that everybody's on the same page. One thing that I wanted to make aware to everybody is that even though October 1st was on Saturday, and that's the date when the new data elements go into effect, some of you will not see those changes reflected in your systems yet, because we wanted to have this conversation before. So that means that if you enter a client on Saturday, Sunday, for those emergency shelters, even today or tomorrow, you might not see those changes. We will put those changes into effect as soon as we're done with the webinars. We just wanted to make sure that you hear first from us before you go into HMIS and start seeing these changes. So I want to thank you first for being here. And without any further ado, let's start. After the review, we're going to have a walkthrough. We're going to go into HMIS to see how it looks in there. And obviously, we're going to have a section for a Q&A at the end. If you, actually, let me go into routine right now. You all muted. Everybody's muted. Not a big fan of the feedback. However, on the GoToWebinar control panel, you can write questions. We'll address them as we go. Victoria is going to help me here with that. And also, if the control panel is on your way or blocking the screen, you see that there's an orange button over there. That orange button, I'm going to click it on mine too. Once you click on that orange button, everything goes away. So nothing should be on your way now. Now, before I go into this part, the second part, I have a question that I want to make to all of you. So please take your time to answer this poll. And this poll will help us. See, can you see the poll? I hope so. It's right there, middle of the screen. You see it? So just take your time in there and answer this question. This will help us to know what programs you have or what programs we have represented right now. Okay, I'm gonna close this poll now. I hope everybody had a chance to answer the question. And we're gonna go to the routine now. Sorry, actually, yes, it's that. Get confused with my own slides now. All right, so this, you know that this has been a very active year. You all have made significant effort and help us to clean a lot of the data stored in HMIS. We will continue to do so. It's been a challenging, I know it's been challenging to you, it's been challenging to us, to the COC, but believe me, we're getting better. There's still a lot of work ahead, but I'm confident we'll get there. Some of you have received a lot of emails lately from this team, maybe more than you ever did, maybe more than you want. But with your help, it was possible for us, again, this includes you, I'm talking about the whole COC. Thanks to your efforts, we were able to submit system performance measures, the NOFA. We are about to start with AHAR. So just be prepared. There's going to be some more emails coming your way too. But this is right now all about data standards. But before we go into that, again, I want to make a clarification. Your funders communicate with you sometimes. They talk about changes or they might give you special announcements. And I mention this because there has been occasions when you have received contrasting information from us. And I understand how chaotic it may sound. That's actually one of the problems of having too many bosses, if you will. A lot of the times you'll find that the emails that you receive from your funders, we don't always get those. We get our information from other HUD sources, from other HUD consultants. So it is possible that in some cases, you will find out about changes before we do, or vice versa. I'll do something, I guess. Okay. Again, I wanted to make sure that you know or are aware of this because I always want you to go by what your funders are telling you. Do let us know if we're sending you information that contrasts with what they're saying. Let us know so we can have the information and so we can get it together with our sources. But your funders, they should be the ones with the most updated information always. You want to know, I know that you want to know what changed. So before, let's just jump into the nitty gritty. I had another question for you, but that question can wait. All right, so we're already in version 5.1. And these changes range from significant to very minor. One of the first changes that you'll notice while doing an intake, the gender list. It didn't change a lot, but it did change other. It used to be other, and now you will see doesn't identify as male, female, or transgender. That's one of the minor but very important changes. Also, and I guess you already know this one, element 3.8, disabling condition, was updated. It used to be reserved just for adults, but now it's for everyone. Thank you, Gary Ullman. Okay, this one is, I guess, in my opinion, the major change that you're going to see in your setup. I'm talking about 3.917 changes. And these changes, I want you to understand that they reflect a real-time data entry process to collect information for chronic homeless status. So living situation is a new data element that combines the old 3.9 residents prior to project entry and 3.17 length of time on the streets, in an emergency shelter, or in a safe haven. If you haven't checked, by the way, the videos, we did a video explaining this. Let me see that over there. Just go to YouTube actually and type HMIS Data Center, and you will find it. It's right there. Again, we're talking here about volume 2. All of this information about this element is explained over there. Oh, sorry, went too fast. This is how it was combined, and you should be able to see these changes when you, again, these elements, this required field for this element is based on a project type for the enrollment and the living situation identified. So this means that depending on your project type, and this will happen automatically based on the setup. If you are entering a client into a street outreach program or an emergency shelter or a safe haven, you will be prompted to answer question 3.917A. For any other project type, the question will be 3.917B. You're probably asking, are there any differences? Yes, there are differences. Actually, 3.9B displays different fields based on the type of housing situation. And this is also one of the other changes that I kind of like, because if you notice now, they're divided. The homeless situations are divided. Now we have a homeless situation, institutional situation, transitional and permanent housing. So I think it's easier to read this way. And also, it's good to know that the 3.917 changes have affected the chronic homeless data collection to reflect real-time data entry. We keep hearing this real-time data entry. What does this mean? Well, for those of you that are fans of the default client's last assessment button, let me just say that on this specific page, the button will not bring any 3.917 data previously stored in the assessment. So every time you come into this page, you will have to enter new information if the information has changed. If nothing changes, you can continue like no changes. But just this will help us to maintain more accurate information in the system. Basically, the main changes on the logic are this. Client entering from the streets, emergency shelter, or safe haven. You remember it was like we had this element divided into 4 or 5 different questions depending on where on the answers that you provide. The client entering from the streets, emergency shelter, or safe haven has been removed. It's no longer there. And approximate homeless start date, number of times homeless in 3 years, and number of month homeless are conditionally answered. Again, we're talking about logic here. This means that your answers condition the next question. So street outreach, emergency shelter, and safe haven projects usually indicate homelessness. So an enrollment on any of this project type basically meets the criteria, and it will prompt you then to the 3.917A logic. But if you have transitional housing, any other type of permanent housing, services only, day shelter, homelessness prevention, or coordinated entry project, for that we will go to 3.917B. And again, you don't have to do anything, just by the nature of the program that you enter information to, and the responses will depend the kind of questions that you will answer next. Okay. Anyways, let's talk about health insurance. Whoa, surprise quiz. By the way, do you know if this element is required by your funders? Okay, and I just want to make this clarification over here. You have to excuse my font choices, but I can help to notice that we're already in October, so I'm already feeling the Halloween. So, does your funder require this element? Well, let's see. Do you receive PAT, RI, ESG, COC, or SSBF? If the answer is yes, then yes, you collect this element. Pretty much everybody. We have a couple of new responses on this element, by the way. I don't know if you can see this. And you notice also that the logic in here or the structure has changed a little. You will notice in there that we have Indian Health Services Program, and also we added other over there. If your funder requires a reason on why insurance is not being received, these are the options over here. To reduce data collection and reporting burden, if a client reports having no health insurance coverage, no additional data is required, unless is required by a specific funder. Okay, the ESG and CSV and other reports were also updated to the new data structure. Now, you know that before the CSV was 4.1, because that's the data standards version that we were in. Now we are in 5.1. I just want you to know that for the upcoming months, ClientTrack will offer both of those versions, or those both formats, 4.1 and 5.1. And this is because, for example, I know that even though the repository for SSBF projects will be updated soon to 5.1, it hasn't been updated yet. But just rest assured that we have both formats available for you at any time. Okay, I guess we can go to the next one. Okay. Residential move-in date. Can you recognize residential move-in date? This is for what programs? This is for rapid rehousing. Okay, information date has been removed from this element. It used to be longer, but now it's gone. Users will no longer be required to enter an information date specifically for this element. That's a huge improvement. So if the client is not in permanent housing yet, then the effective information date is the project entry date. Okay, just so you know, that should be the same if the client is not in permanent housing yet. Once the client goes into permanent housing, when you change that no to yes, then the effective information date is the same as the move-in date. Okay, that's one of the changes. They remove an extra set of data there, but this should be easier to calculate, and that way you have less to worry about with having too many different dates in there. Now let's go to PATH. All components of PATH-funded programs are now required to collect data element 4.121, connection with SOAR. Pretty self-explanatory. Connection with SOAR exists. Yes, no. Just as simple as that. Again, this is for PATH programs only. There was some changes also in the service codes as well, so you know. I don't know if you noticed, but for example, outreach is gone. Instead of outreach, now we have re-engagement. Screening assessment was broken into two. Now we have screening on its own, and then we have clinical assessment as well. The rest hasn't changed much. We have habilitation, rehabilitation, community mental health, substance use treatment, case management, residential supportive services, housing minor reservations, housing moving assistance, housing technical assistance. Oh, this one actually, you notice in there, it says housing eligibility determination. This used to be housing technical assistance, but it's no longer that. So, again, that was another change. The rest hasn't changed. This referrals has been a huge topic, and I'm preparing a very detailed video to explain how the whole project works in HMIS. As of now, we do have some videos on how to record referrals in HMIS. You can find the video in our YouTube channel. Victoria made it. It's very simple, right? I mean, it's not very complicated. Do you know how long is it?
There are 2 separate videos, and so they're about 3 minutes each.
3 minutes each. 6 if you combine 2 of them. So that's not a lot. Take a look at those. I mean, that will help you. And again, to all my PATH programs grantees, I know that we will be talking soon. Also, I want to make note that income and other sources is now a required field. Before it was just encouraged, but not anymore. So be sure that you capture the information, income, and what kind of services. What kind of benefits the client is receiving at project entry. Remember that that's very, very important, because any increases or decreases in income will reflect in your outcomes for the program. So it is very, very important that we collect at program entry, at program exit, if your client stays there for more than a year, every year. But you guys know that already. All right, so this 4.24, last grade completed. This is not really a new element, but it was only required for RIE programs. Now it's for SSBF programs too. This screen will look a lot like this. And these are the options. And if your client finished high school, achieved diploma or GED, then you can choose what kind of secondary education he or she has received. This element has been updated with new response categories as well, if you can tell. Now we have associate's degree, bachelor's, master's, doctorate, and certificate of advanced training or skill artisan. Obviously, although this element is to be collected by both SSBF and RIE programs, due to the nature of RIE, I'm guessing that we're not going to have a lot of doctors there. Not yet, at least. But just be aware that those changes have been made, and you will probably see them in your system soon. All right, let's go now to my SSBF peeps. HUD required, well, actually not required. Well, required 4.48 HP targeting criteria. If you don't recognize the name, it's because it's a new name. HUD retired element 4.44 HP screening score, and now we got this 4.48 HP targeting criteria. It's an assessment within an assessment. It's kind of like Inception, I guess. This form calculates the total points based on the responses. So ClientTrack is used here logic using the screening toolkit provided by the VA for the scoring. Now, there are some redundancies between this element and other data collection elements, including 3.8, disabling condition, 4.2, income and sources, 4.41, veterans information, 4.42, income as a percentage of AMI, and data related to household composition. Now, consistency in these responses for this data element and others will be used in evaluation for SSBF data quality. One thing that the VA asked for was the ability to edit records, and the form will check for consistency and provide a warning if the data has changed. For example, if income at entry was edited since the last since the last time that you went into the form, this HP targeting criteria will use the updated income at entry for validation, so you know. Another new element for SSBF is 4.49, use of other crisis services. Use of crisis services is a new data element. ClientTrack created the form to allow data collection for this data element. This form will appear during the project entry workflow for SSBF funded projects with the types of homelessness prevention and rapid rehousing. You can see the answers right there on the screen. That's how it's going to look. The kind of answer you have to provide. One of the changes that I am actually very, very, very excited to have is this one. ClientTrack finally decided to differentiate between update and annual assessment. The first step actually is the same. You use your action button, that little blue circle with the arrow, find annual assessment or update, and then you reach the crossroad. It might be a bit confusing at first, but that new assessment that you see over there, that new assessment means that this assessment is a new for a client that has been in your program for more than a year. Okay, so that's the annual assessment, a new assessment for that client. If your client, if you want to make an update to a certain element, like adding a moving date, for example, for that you choose, well, update existing. Now I'm going to go on a limb here and pretend that you all know that if you're adding an annual assessment, the day should be 3 days before or after the original entry date, only a year after. Wait, hold on. I'm sure there's a better way to explain this. Victoria?
Yes, so as Jesus was saying, if you are doing an annual assessment, please be sure that your annual assessment falls within a certain date range. So you really want to complete that annual assessment 30 days before or after the month and day of the original entry assessment.
And thank you, Victoria. And one of the other things that is really cool about the new change here is that ClientTrack will now warn you if the assessment date is outside of the window of time in HUD's guidance, which is really, really cool. Now, bear in mind, the warning will appear and be there, but that will not prevent you from saving the information. Okay, the warning is just there to like warn you, hey, you know that this is not during the same date. But as we know, there's some updates that happen outside of those dates, so you will be able to record your information regardless. But just know that if you see the warning and you're trying to enter an annual assessment, you might want to consider your date. Change your date, I guess. Okay. I guess we're ready to go into and see this in action. I'm gonna take a little break here and see if there's any questions that are pending. No questions. Wow, it's really good. If there's no questions, then I am going to ask you another question then. And after this question, we'll continue and go into ClientTrack. Okay, so let's close the poll now. Thank you for everybody that voted. We have a good amount of people that already read the standards. That's good. We have another percentage of people who haven't read it, and I'm actually really concerned about those who don't know what it is. But we'll go into that later. Can you see my screen right now? Can you see a ClientTrack? Yes? Awesome. Okay. So what I'm going to do right now is I'm going to go in and I'm going to enter a client as if it was a new client. And as we go, you start to see some of the changes that we notice. I'm going to try not to talk too much so you can see what's going on. But do feel, again, if there's questions or something doesn't look right, I mean, let us know. For this specific example, I'm going to use a client and I'm going to enter the client into a homelessness prevention situation, just to show you what it's like. And then, I mean, if we have more time, we can go and enter another one into a different project, just so you see the differences. But based on the programs that we have represented today here, this will cover pretty much what you need. All right, so we're going to start with a new client over here. And as you guys know, this is something that I wanted to do for a long time. How to start or how to intake a client the right way, because sometimes we get a lot of duplication, and that is never good, because then we have to work extra hard to correct those things. So the first thing you see here when you enter a new client is you have 4 different fields in there. Now, what I recommend is do not fill them all up. Even if you have all of this information, don't do that, because you might have a client. For example, I'm going to start here with my client. I'm going to name my client David Bowie, because I have no imagination. If I have a social security, I will enter it here. But then if David Bowie is already in the system and he never provided a social, well, I'm not going to get any results. However, if David Bowie is already in the system and I just put his name, once I go to the next page, I will be prompted, hey, this client is already there. In this case, the client is not here, so that's no problem. But just so you know, I mean, you can start just with first and last name, and then from here, then you can enter the rest of the information. So name quality, that means that the client provided the right answer, or the entire name. Now, if you have a client really and he provides the name David Bowie and you're not sure because he didn't provide any other information, well, then you might want to see if this is actually an alias or a street name and not a real name. There's different options in here. But again, if you have a real name, you use full name reported. If this is an alias, as we're talking about, like for street outreach projects, then we will go here and change this to partial street name or code name reported, just so you know. And then from there, we'll go into the social. Now, this is a very hot topic, because usually, I mean, especially for agencies that are in the Valley, for example, I mean, there's not a lot of socials in there. Now, can you prevent them from going into the project? No. But we need to ask the question, social security number. If you only have the last 4 digits, that's good. That's good. We can use the last 4 digits for sure. If you don't, as you can see, once I entered a number, the quality disappears, because then it assumes that, hey, you have already answered that question. Now, with client doesn't know, I mean, well, obviously, if the client doesn't know it by heart and doesn't have it, well, the client doesn't know. But if the client returns and now he has it, well, then we can update this information. Again, if your client doesn't have a social, well, then you can leave it blank. But just understand that, for example, having 1 missing is okay. Having 10, well, it gets a little more trickier, because then we're not just talking about your agency. Let's say that you are missing 10 and everybody else is missing 10. Then we have the whole COC missing. Like, I mean, we have like a lot of agencies. We have like close to 200 different agencies. So if we add it up, I mean, yeah, I mean, the aggregated data will, like, our data quality is not going to be the same. So just be aware of that situation. Again, if you're missing 1, 2, that's fine. But always try to, again, if the client doesn't want to provide the whole number, just get the last 4 digits. That's good enough. All right, so birthday date, obviously, if we know the date of our client, we can put it over there. I really don't know when David Bowie was born, so I'm just gonna say it like that. Obviously, he's much old. He was much older than that. Date of birth quality, again, if you know that this is true, well, then full date of birth reported. There's options where if the client say, well, I mean, it doesn't remember, and it gives you an approximate, well, you can use that as well. But just know that try to use this too. If the client doesn't know, you can always try to calculate, and that can help too. Again, if you calculate, then you're not using full date of birth reported, you're using approximate or partial date of birth reported. We're trying to steer away from that and not selected. All right, ethnicity, we're gonna go in here and say that this guy is not Hispanic. Again, I'm not making an assumption. I know David Bowie is not Hispanic. And then race, we have it here. We're gonna say that the guy is white. Also, if you, I mean, for those of you that don't know, you know that you can pick more than one answers here, right? If the client associates with more than one races here, you can pick as many as he or she says. Gender, all right, that was the first change over there. The other is now doesn't identify as male, female, or transgender, which I think that early David Bowie was kind of like that. But now, later, David Bowie will go just as male. Disabling condition, again, this is for everybody, not just for kids. We're going to say that, well, even though at the end of his life he did. Veteran status, yes, no. We're going to go in there. Just remember that if this client was a minor, you don't have to answer this question, veteran status, for obvious reasons. Family, you leave it blank because this will be completed automatically. And just make sure that if this is your first client for this family that you're entering, this is a self, okay? This is self. For all of the right projects, you have minors, but since you're not entering the parents, then that minor becomes the self or the head of household. Let's go into the next one. Okay. Now it's asking me in here if you have family members. Obviously, you know, if you have family members, you can add them in here. Just make sure that when you add the family member, you scroll to the right so you can answer all of the questions that need to be answered. All of the questions that are required, they have the red asterisk over there. Yes.
I would like you to demonstrate entering a child because it never seems like a smooth process.
Okay. All right. Let's see. Let's enter a kid in here. Let's say that the kid's called Shane Bowie. The question was if I can enter a kid in here because obviously sometimes it's not as easy as it looks. That thing that you see jumping in here is my indicator. Obviously, if there was another Shane, and I wrote it incorrectly, obviously. I don't have my glasses on. I mean, I do have them, but it's kind of far to see over here. So if there was another Shaheen Bowie, we will see it in here. And then if that's the client that I'm looking for, I can just click on it and continue. But in this case, no, there's no other, so I'm gonna just go straight up in here with this client. And let's say that this is female, and let's put a date of birth here. I don't know. I'm really not thinking about dates over here. If we put on 2001. But yeah, that's 15 over there. So full date of birth reported. Yeah, we have that. And then the social, last 4 digits I'm gonna use in here. Social, once I go here, I can just put approximate. Sorry. And relationship to head of household. We're gonna say that this is a son, a daughter. Sorry, a daughter. And that's it. I don't have to answer any of these questions right now in here, even though there's a mistake because the salient condition should be operated. But like I said, I mean, a lot of these changes will not be reflected yet until we actually made the changes over there. But yes, you will have to answer that question over there. And then, if I click save, it will save it, but keep me in the same page. Or in this case, erase it, as it did in there. Okay. Hey, what happened here? Is that what Alice was mentioning? Oh, sorry. No, it disappeared, the whole thing. That's no good. Let's see. All right. Again, this is 0101 2001. I'm gonna go with the last 4 digits. This is daughter. Hispanic or Latino. That's good. Saving flows. Wait, what is this? Restriction is a required field.
Since it might be a ClientTrack issue.
Yeah, this might be a ClientTrack issue. I'm gonna check into that. If this is something that is going on also in your project, please let us know. Because since we have different projects, different funding sources, the workflows are slightly different. So if you're experiencing a trouble like this one, I mean, and just bear in mind that right now I'm in the training side, so this one, it acts a little different than the normal one. This is the training side. But you should not have this issue. If you do have it, we will address it as we go. So I'm gonna just go and skip this one right now. Program. Where are we going right now? I have a bunch of programs in here, but I'm gonna go in this with homelessness prevention. Okay, so I have my entry date. If I click in here, it's gonna give me today's date. So if you're doing back data entry and you want to change this date, then the rest of the assessment will have the date that you choose here. In this case, I'm going to leave it like that. And I'm going to go in there. And obviously, this is myself. All right, so this is some of the changes that you probably will see. We have a housing status. It's not required, although if you have that information, for example, if you're working with a homelessness prevention, well, then this client is not homeless. This client is at risk of homelessness. Then, since I'm doing this for an SSBF program, I have to calculate this percentage of AMI. I'm going to say that it was less than 30%. The HP screening score, I don't have this in here yet because I don't do this very often. But later we'll get this information. I'm just going to say in here, I'm just going to put a random number, so don't quote me on this. I'm just trying to go ahead. Most SSBF users already know this information anyways. Again, this is a made-up number. Client location, if you don't see in here Texas balance of state, do let us know. We need to know that because then all of your clients are not going to be assigned to the balance of state. This is a very simple thing to fix. If you don't see it, let us know. Residence prior to project entry, where the client was before he came here. Now, again, I'm in training site, so I don't see the new display that you guys are gonna be seeing. But I'm gonna just say that this client had a rental with no ongoing subsidy. How long stay there? Let's say that 1 year or older. Yes. Full address reported or no, depending on your answer. I'm going to say full date reported. Well, actually, no, not right now because I don't want to enter that date. Is the client coming from the streets? No. Has the client been in this situation before? I'm just going to say that this is just the one time. One time. Health insurance, again. You know, I'm probably not in the right one here. Yes, I'm going to have to cancel this, and I apologize for this, but this is not the right workflow. But I'm glad that we're seeing this right now. Oh, okay, I know the problem. This is it. It's the work group. Again, this comes into play because, like I said before, we need to make sure that all of this is addressed. I'm going to start this over. Maybe this will work a little better. I'm going to use the current client. There's no changes in the first page. Here, I'm going to try and see if I can work this one out here. Shane Bowie. No Shane Bowies. Date of birth 0101 2001. That. Oh, it did it incorrectly. Zero one 2001. Okay, that's better. Female. 99. Can't type today. All right, so we got that. And is this daughter? Disabling condition, you see, yeah, this one, it's a question that regardless of the age of the client, you will have to respond. And in this case, we're going to say no. And yes. Can I save this? What is the issue here? Oh, okay. There's a public, okay, it's telling me, the system is telling me that there might be a duplication. I mean, it recognized a client with the last 4 digits that I entered there, you see? But this is not the same client, so we're not going to do, we're not going to change it. But the system will warn you, which is a good warning. Okay, program. We're going to go again to homelessness prevention. Sorry? I'm going to do both in there. Okay, and okay, did you notice, other than asking me the question whether the client was a duplicate or not, I was able to add the daughter of David Bowie. All right, we're going to go here and save this part. Okay, now, all right, this is less questions now, as you can see. All right, the housing status, I'm going to put at risk of homelessness again. The income, I'm going to say less than %, and I'm going to put a random number in here. Now, you notice that in the previous one, there was another question in here for SSBF projects. It's no longer there. It's going to come into effect later, not in here. Again, client location is there. Type of residence, where the client was or is currently. In this case, the client is not in a homeless situation or institutional. He is in a permanent housing situation. I'm going to say that he is in a rental by client with no ongoing subsidy. Yay. Now, did he stay or she stay in there for less than 7 nights? I'm going to say no. And once I answer that, I just have to answer one more question here. how long was the client in there? Let's just say 1 year or longer, and that's it. If you have the address, obviously that's a required field for SSBF projects. You can fully report the date over there. For this case, I'm gonna just go client doesn't know, but I know that you have that information. All right, health insurance. As you can see, the new options are here. The display is different. If you say yes, obviously you're gonna have to come over here and enter the information. If this is a yes, there's no other question that you need to say. But let's say that you have a client that doesn't have insurance, but he's working to get the insurance. So you say no in there, but then, sorry, you say no, and then depending on, let's say that he's in the process of getting Medicaid, and then you can put here, he applied, there's decision pending, or applying, the client was not eligible. You can select any answers that fit the criteria of your client. Okay, income from any sources. Again, this is very important because it can tell us if your program is working, if their outcomes are positive, and it helps with system performance measures as well. So let's try and put in there if there's some income going on. You can add it over here. Let's say that this is like 300. Obviously, non-cash benefits also might work. So that there's like 200 in there. Save and close. Okay, this is the part I was talking about before. This is the assessment within the assessment. And this is the HP targeting criteria. So you have to answer all of these questions depending on where the client was before. I probably should start reading all of this right now. Say no. And then yes, I mean, again, there's a lot of questions over here, and all of the questions are required. Obviously, as I'm answering all of these questions, you will see that a score is being prepared over here. As I'm getting closer, the number changes, obviously. Say no. One time. No. 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 Yes. And obviously, I'm gonna say yes, even though I say no on the other one, because for SSBF projects, obviously, I have to be a veteran. In grantee targeting threshold score, again, this depends on the projects. You probably have already this answer. I'm just gonna put in here like a 2, but you know the answer that should go in there because I don't. This is the other new, element, crisis service assistance. If the client has been or have been in any emergency room in the past year, yes, no, how many times, number of times the nights spent in prison, say 0. Approximate number of nights the inpatient medical facility center, I don't know, say 0 in there. Save and close. This one also, it's now required for SSBF projects. Highest grade completed. If the client has been or finished school, has a high school diploma, put that there. And then if there's any other in here, any information, you can add it over there. If there's nothing, well, then no. If the client attended college but didn't finish, I mean, you can put in there some pending. Okay, as you can see in here, this is one of the things that we're saying. Like if your information conflicts with what you're answering here, because 3.917 reflects real-time data entry as described in the data dictionary, the default last assessment button will not bring any data. I'm back into this just because I have to answer this question. So I'm gonna say in here no, even though I have to say yes, and see what happens. Oh, this is actually the kid. Sorry, this is the kid. I'm completely confused now. It's too early for this webinar. Okay, so this is the kid. So obviously I had to enter the information if there's any insurance. And then the assessment, obviously. That's that. We enroll our client. Yay, it was possible. So, okay, as you can see, I mean, and again, this is like the second or third time that I'm doing this, and even now I'm having like issues sometimes understanding a lot of these things. But with practice, we'll get there. I have another question before I let you go. And we can do another programming here if you're into that. But this is actually very important because we've been thinking of having more sessions, maybe a monthly session, an HMIS session where we can connect and go over changes, go over things, address your questions in a forum where you can come, ask questions, send us questions before, and we can have it in a more friendly environment without having this setting of webinars. So I wanted to ask you this question. And please let me know what your answer will be, because I feel like the more connected we are, the better we'll become at this. Again, this is a process. It doesn't happen overnight. And I want to make sure that we can provide everything in our end to make your life easier. Because if your life is easier, believe me, our life is easier too. I'm about to close the poll, but I guess it's very telling that we have a 50-50 right now on having a monthly call, and 50% says yes to have a monthly call, and 50% says how about 2 months, every 2 months instead. Wow, we need somebody else to vote so we can vote. Wow, okay, somebody voted yes to the monthly call, so now we have the 53%. So, and we'll have 86% of our attendees voted already. So, I guess it's gonna have to be a yes, monthly call, unless all of those that are in favor of 2 months instead and haven't voted vote now. Okay, if it's set for every month, we will send you probably like a survey to because I want to assess what days will work better. I want to see what times will work better for everybody. I just don't want to assume and send like this time. I mean, like having a webinar at 9 a.m. is kind of like a little too early. But at the same time, I wanted to keep it out of the way and do it early so we don't have to worry about it later. Um, but I do want to take your input. So we will be sending a survey to everybody, to all of our users, and based on those responses, we will come up with the times and days to have this. But as it turns out right now, with 86% of people voting, we have yes, a 53%. So I guess it's gonna be monthly. Thank you very much for your votes. Okay, so I got this one already. This client is already enrolled. If you want us to go and enter another client with a different project, more than glad. Now, I do want to, one of the questions that we had, are we penalizing projects for not having socials? Not to my knowledge yet. I mean, I don't think so. Obviously, again, this is a specific characteristic of your of each project. If the clients that you're serving don't have socials, I mean, there's nothing that really, I mean, we can do. Um, what we insist on is do not put immediately data not collected or a client doesn't know. We encourage everybody to ask the question and see if we can produce a social. If that social doesn't exist, well, then it doesn't exist. There's nothing else. Again, we're not encouraging everybody to either refuse the services or anything like that. Just want you guys to be aware that it's not just your program that at the end of the year gets counted. I mean, we have aggregated data of almost 200 different programs. So a 10% in one project, it might not reflect a lot, but a 10% on every project, then yes, our data quality will suffer. So we don't want to go into that problem. Okay, so let's do another project. If you have already, I mean, I know that Victoria has been answering some questions already in the system. I mean, do we have any other questions that you want to mention? No, not right now. Okay, I should have made another poll asking, do you guys want to do another client? But since I didn't, so I'm going to produce another client over here, just for the sake of argument. And this time I'm going to do it on a rapid rehousing. I'm gonna add a new client. And again, I'm gonna go with the name. All right. So this is a new client. Again, that's the full name reported. I have a social. Well, actually, I have a social in here. Obviously, don't mimic this because this is not real. Date of birth. I'm gonna say that this client is 1993. 4. I do. Obviously, this client is not 122 years old. Okay, hold on. My glasses are not working anymore. 2000. No, 1994. Is that correct now? Yes, okay, 22, that's better. Full day reported ethnicity. Let's say that this is not Hispanic or Latino. Let's say that she identifies as Asian. And gender, female. Now, you see, ask about pregnancy status. Yes, no. I mean, this is one of those instances when you can put don't know if the client says don't know. Sexual orientation, we're talking here about if the client identifies different, we're gonna say that no. That's a no. Sibling condition, yes, no. Better than status, yes. All right, finish. Okay, I'm not gonna put a kid in here. I'm just gonna go with her. And this is gonna be rapid rehousing. So, if we remember correctly, this is rapid rehousing. We have a project entry date. Do we have a moving date? I'm gonna put in here the same date as the project entry date until later. All right, so we have the questions in here again. Household income, 30, 50. The station, I don't know the station numbers. You guys know them better than I do. And type of residence where the client was before. In this case, we can say, I mean, this is rapid rehousing. So this client probably was either an emergency shelter, place not meant for habitation. It could be institutionalized, any other situation. Let's say that the client was staying with a family member. Did they stay the client there for more than 7 days? Yes. You see, I entered yes, I have another question. If I say no, there's no other question. So I have to make sure that I answer the questions that the system asked me to. How long did staying there? Well, let's say the 2 to 6 nights. On the night before, did you stay on the streets? I mean, before those 6 nights, yes or no? You can say no, or you can say yes. And if you say yes, then the logic applies and you have to answer all of those questions as well. Okay? Now, don't say no just because you don't want to answer those questions. Not that anybody's doing it, but you know that all of this information really, really help us determine chronic homelessness and to count everybody that needs to be counted. So just be aware of that. The date I'm gonna say right now, just for the sake of this, I'm not gonna go into that. Insurance. Does the client have insurance? Yes, no. And save. All right, branch of military. And here I'm gonna show my colors because I really don't know a lot about the military. But let's say that this is like that. Now, service entry date. Now I'm working in here with a 24-year-old. So, I mean, please do not take my answers as definite. What do we say here? 2010, let's say. Even though probably at that age, the client was still a minor. Where the client serve, we can enter this here. Obviously, if you have you click there, you say no to all of them, and then you can choose which one was actually where the client was. If I try to save it like this, I mean, just in case, because I don't really know these answers, but you, SSBF people, you know these answers. Again, income and sources. I'm not gonna go into it right now because I did it on the other one and we're trying to go fast, just showing you what's different. Number of visits to an emergency room, past 3 years, no, 0, 0 for this one. And let's say that he was actually in a medical for 2 days. Save. Okay, let me go back to this one. Just because of one detail. Usually the save one is on this side. I mean, like, be aware that if you click no changes and you haven't answered this, probably it's not gonna allow you to go further because you put no changes if there's no information there. This is obviously in cases that you're doing an update and this is not something that you need to change, but you need to go to the next page. You don't have to click save. You can click no changes and it will move forward. Highest grade completed. Well, it's going to say that this client had a GED and she did some college. I didn't answer these questions. They're not required, but if you have that information, feel free to put it in there. The more information we have, the better. But again, it's not required. I just didn't want you to think that I was ignoring those questions. And that's that. We have the client enrolled. Again, we went over the changes. We show you how they look in the system. Let me go back to my presentation because we already saw that. And now I'm just gonna open the floor for some questions. If there's any questions, this is the best time to ask the questions. Again, you can use the chat. You can send a question in the question box. But if you don't have any more questions, then I want to thank you for being here. Thank you for your time. I know it was super early. I hope this was useful. Again, we went through a lot of different things. This webinar is being recorded with all the mistakes that we went through. We're not going to edit any of that. So make sure that if you see any mistakes in your workflows, let us know. Let us know so we can help you out and address the issue. Again, a lot of these changes, you're not going to see them right now. We're going to work this week on getting everybody situated. And one of the things that I want to also express is that we will be sending you emails. If you have clients that were already enrolled before October 1st and are still in your project, those clients you will need to go back and answer some of the questions that are new in this this update. If you receive an email, please let us know that you received the email and that you're working on making the corrections, and let us know when the corrections are done. It's very important. It helps us. We will have your back. You have our backs too. Other than that, if you have clients that were supposed to exit before October, they're no longer in your project, you can exit them. You don't need to answer any more information about them, provided you exit them before October. But for any other client that is still in your project, we will let you know. We will send you some emails telling you, hey, you have this many clients and this is the information that you need to complete. Please go and add the information. Again, this will make us better each time. We're working on AHAR right now, so we will appreciate if you guys help us. We want to have the best AHAR ever. Last year was pretty good. Actually, we submitted more shells than ever before, and I'm really proud of that. I'm really proud of my team. I'm really proud of you guys, and I do want us to do even better this year. So with your help, I know we can. If you don't have any more questions, thank you for attending, and please encourage any other member of your staff, your colleagues that haven't or that weren't able to be in this webinar, to come and join us tomorrow or Wednesday or Thursday or Friday. On Friday we have actually 2 people that submitted, so that's going to be a very intimate session. But yes, again, if this was not enough, if you were still confused, we will try this again tomorrow. You can come in and connect. But know that this webinar is going to be available for you guys. Thank you very, very much for your attendance. Do you have anything else to say, Victoria? No more questions. Thank you very much. We'll see you guys soon.